Hi, my name is Hilary Paulson, and in this video I will try to explain to you a little bit about teratogens. A teratogen is an environmental agent, such as drugs, chemicals, or a virus that produces a birth defect. These agents pass through the placenta and into the developing fetus. Other examples of teratogens are alcohol, nicotine, cocaine, and amphetamines. The timing and quantity of exposure to the teratogen is crucial. In this case, we will be talking about alcohol as our teratogen. After an egg is fertilized by the sperm, the resulting zygote travels to the uterus and develops into an embryo. Cells begin to divide to increase the embryo's size, and then migrate to the fallopian tubes towards the uterus, where it eventually settles, implanting in the uterine wall. This does not occur until nearly a week after conception. After implantation, growth of the supporting structures such as shared blood vessels begins. Finally, about 2 to 3 weeks after fertilization, the embryo shares a blood supply with the mother. It's around this time that the embryo can be affected by the teratogens. At some stages of fetal development, a teratogen may have minimal impact, while at other times the consequence may be profound and cause effects such as fetal alcohol syndrome, brain damage, and even limb abnormalities. Usually, teratogens have the most severe impact during the periods of rapid prenatal development. Also, some teratogens can have different effects depending on racial and cultural background, such as Native American fetuses are more susceptible to effects of alcohol than European American fetuses. Furthermore, different organ systems are more susceptible to damage from a teratogen at different times of development. For example, the brain is more susceptible between 15 and 25 days after conception, where the heart is more susceptible at 20 to 40 days. Not only is timing and exposure important, there is also the threshold effect to consider. The threshold effect is a phenomenon in which a particular teratogen is relatively harmless in small doses, but becomes harmful when reaches a certain level, the threshold. The levels vary depending on the type of teratogen, such as drugs, chemicals, and viruses, as I listed earlier. In Sarah's case, we are talking about the teratogen alcohol. Alcohol can have a serious effect on the baby, which is called fetal alcohol syndrome. Fetal alcohol syndrome is a cluster of birth defects including physical, cognitive, and behavioral effects. Physical effects may vary but can include distortion of facial features, distortion of limbs and joints, delay in growth, heart problems, and sensory difficulties. Cognitive effects can include mental retardation, learning disorders, delayed cognitive development, and others. There's also the behavioral effects, which can include deficits in attention, hyperactivity, poor impulse control, extreme nervousness, or anxiety. In this picture, I have shown some of the facial effects. Because of all these potentially harmful effects for the fetus, doctors recommend that alcohol consumption is completely stopped when trying to get pregnant. I would let Sarah know this information and inform her to stop drinking. It would also be best if Tom stopped drinking as well until she is pregnant. New studies have shown that alcohol can affect sperm and cause it to be slower and have defects. If one of these sperm fertilize the egg, it could cause chromosomal defects such as Down syndrome. Thank you for watching this video. I hope you now have a little better understanding of teratogens.